Here's how gay men can contract monkeypox, what you need to know. The current monkeypox outbreak has been covered extensively by the media. According to the Center for Disease Control, there are currently just under 9,000 cases in the United States. Currently, 99% of cases in the US are males, with 94% of cases being in gay or bisexual men. Why is this virus targeting our community? One reason is in the way it spreads. It can be spread by skin-to-skin contact, as is frequently found in bars and dance clubs. The gay community, more so than our straight counterparts, are likely to be shirtless while dancing in a busy bar. Brushing against someone with a monkeypox rash or scabs can spread the virus. The gay obsession with having a perfect gym body can also be a cause. Gym equipment and towels can spread the virus if they are touched by someone with an active monkeypox case. Being sexually active can also spread the disease. While monkeypox is not a sexually transmitted infection, it can be spread through sexual contact. This is not limited to penetrative sex, but also the simple acts of intimately touching someone or even hugging or kissing them can spread it. While this may sound frightening, it is important to remember that monkeypox is not generally dangerous, only painful. It is also good to know that existing vaccines for smallpox are very effective against monkeypox. While this is not a disease that specifically targets gay men, there are risky behaviors that increase the spread. We recommend everyone get a vaccine as soon as possible, as you are able.
There is one FDA-approved vaccine for the prevention of monkeypox. The vaccine, which is called JYNNEOS, was approved in 2019 for the prevention of smallpox and monkeypox disease in adults 18 years of age and older at high risk for smallpox or monkeypox infection. The vaccine is made from a modified vaccinia virus that cannot reproduce in the body or cause disease on its own, and does not contain the viruses that cause smallpox or monkeypox. Studies have shown that 2 doses of the JYNNEOS vaccine, given 28 days apart, can provide protection from monkeypox.
There seems to be a lot of fear of monkeypox, and I think that there is a lot of misinformation. First, we know in Britain, especially, Britain starting the conversation and now moving to America, there's this, it's the gay disease, and they're making these comparisons to the way AIDS and HIV moved from the community. It's completely different. AIDS and HIV were a sexually contracted disease among gay men, how it started, and moved beyond that, of course. This situation is a typical example of the spread of the virus, which is what's really critically important. You can't get beyond that. This story, I think, is very interesting because it is explaining why it is the majority of gay men. Not that gay men are contracting it in an active way, it's a passive, inactive way. Dancing in clubs of skin-to-skin contact, etc. And that's really important for our conversation. Gay men can limit the exposure to monkeypox by making sure that they're comfortable in terms of the skin-to-skin contact that they have. And in gyms, wiping equipment down and sterilizing it.
Yeah, I mean, we've dealt with, the whole AIDS crisis, and we know about all that, and being active and alerting one another and getting out there and making a difference and raising awareness. So we just have to do this as well. We have to raise awareness and make smarter decisions about what we're doing and the amount of people, and like these large sweaty clubs that people are rubbing up against each other are fun.
Which ones? Where are
they? But, it's common sense, and until this thing abates, eventually, hopefully it will, we just have to be smarter and make those proper choices. And I think it's everyone's responsibility.
I'm curious, does anybody at the table think that individual states of emergency have been declared in some states, New York, for example, it's being discussed on the federal level. With 9,000 cases in America, South Florida is a significant percentage of the cases. Broward County is a very significant percentage of the cases. But with that, in terms of the numbers, does anybody think that this doesn't rise to a medical crisis, kind of like the drum that's being beat in the media?
Well, I think that the making it a national emergency is, of course, based on the fact that we don't have as many vaccines. So if it were to spread uncontrolled in some capacity, we don't have enough vaccines to vaccinate the country. So I guess it's more of a warning sign than anything else.
The speed of the spread, I think, is what makes it alarming. The speed of it. It's
and then
been
the strain that it would put on our healthcare system if it were to become uncontrolled.
Another question I have is just in general, your reaction and taking the temperature of the gay male community, gay men in our community. Are you worried about monkeypox? Are you worried about transmission of monkeypox? Is it active in your decision making in terms of where you're at or what you're doing?
Well, I thought we were doing the show tonight topless, so I'm a little. No, I did. I did get my first shot. I'll be getting my second one soon. So I mean, I think it is important that we,
And did you do that over fear? Or
no, just over, I think, responsibility. It's my responsibility to help stop
The reason I asked the question on the fear is basically in South Florida, if South Florida is any example, and we're probably a positive example, you can't get, for all intents and purposes, you can't get the vaccine because of the number of people trying to get the vaccine versus the amount of vaccine available in South Florida. The two different numbers are just dramatically, there's a disconnect. If you add Birmingham, Alabama or Mobile into the mix of where you're trying to get it, it's impossible to get the vaccine. So that's why I asked the question, are you scared? Are you worried?
I've definitely had, I agree with you. I think that responsibility plays a lot into it. But I mean, obviously no one wants to get a disease that causes pain, can potentially scar you. I've had friends who have traveled down here to South Florida because of vaccine availability. Tallahassee just had their first monkeypox case, and you can't get the vaccine there. But I think there's another danger that we're missing, and that is how the media is talking about how monkeypox plays into the LGBT community. I think it is very dangerous for us to be scapegoated as the cause of monkeypox. We saw violence and a backlash occur against the AAPI community as a result of COVID, and I think we have a responsibility to call that out and not to play into that narrative.
And at the same time, Ryan, though, we do have to be responsible because you see people out there just throwing caution to the wind and hoping they'll get everyone's racing to get the vaccine. But a little bit of, an ounce of prevention is worth a pound of cure. Yeah. So, I mean, I think part of the blame is to be a little more responsible. All your points are well taken. We're often made into a scapegoat. But we also have to rise up and be responsible and make smarter choices.
Does anybody think the amount of vaccine that is available and the speed of how states and the federal government are responding is like the early days of the AIDS crisis? It's a gay thing, which is your point. It clearly is not. That is absolutely incorrect. It is absolutely incorrect. It's gaslighting as you move it into those areas because you have a motivation to do that. But does anybody think that the relative slow response, if it is a health crisis, is we're not moving at speed because it is purportedly mostly a gay male response? Does anybody worry about that?
It's also not a death sentence.
Right.
So, I mean, I don't think you can compare the AIDS crisis to monkeypox.
Yeah.
That is, of course, there are risks with monkeypox that, there are a percentage of people that could, have very bad side effects or also complications. But in general, it's not comparable. But I think it's more the nuisance.
Last question I have about monkeypox. Are we going to take this seriously? Is your feeling of your circle of friends, your immediate circle, your secondary circle of gay or LGBTQ friends, you feel like we're going to take this seriously or we're not?
I've had a lot of friends that have taken it seriously. I too have went and got my first vaccine because it was available. And again, if you can prevent something from happening, I don't see any, and it's medically tested as it has been. Why not do that? And we have a higher prevalence here than in other parts of the country. So for me, it was about prevention.
I think the reaction's mixed. I'm sorry, because you do see on Facebook people going out and throwing caution to the wind to these big parties and. There was one I saw they were going to do like an exchange of things, and it just seemed kind of crazy at this time to be engaged in that kind of stuff, And again, I'm a super advocate, and I'm definitely a sex positive person, and I think people should, have the freedom to do what they want, but let's be more careful.
I agree. I think there's definitely a mixed reaction. I think there are some people are throwing caution to the wind that have COVID fatigue, but I see a lot of people taking it very seriously, and it's my hope that especially vulnerable communities like those who are immunocompromised in our community are taking this especially seriously, and we're prioritizing getting them vaccinated.
Okay.
So I have friends in Florida, in the United States, and in other countries who have contracted it. They've all had very different experiences. My close circle of friends here are taking it very seriously, and I know for a fact that they are making different decisions now because of it. And in dialogue with those friends from across the globe, even though they did contract it, they're indicating to me that their friends are also taking it seriously. So I think it is on our radar in an effective way.
Interesting. Okay, well, we continue to follow the story of monkeypox for sure in our community. LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Laura are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.